and we are going to discuss about each drug will be discussed every day. And today we have the opening ceremony of the same, and I take great pleasure in inviting Dr. Rajkumar, our treasurer of IAP-TNSE, to deliver the pediatrician's prayer.
Thank you, Namada. Pediatrician's prayer. Grant us the quality of holistic healing. May we humbly realize how privileged we are in being bestowed with the ability to alleviate suffering. May we be emissaries of health, learning, charity, love, peace to all children and their families, irrespective of status and creed. Give us the wisdom, understanding to change the things we can, retain the good, and accept within reason the things we cannot change. Grant us your blessings, grace, and mercy in all situations, at all times, and amidst all people. Thank you.
Thank you, Dr. Rajkumar. Now I request Dr. Rajendran sir, our president, to give his presidential address and welcome address.
Thank you, Dr. Narmada. Respected today's chief guest, Dr. Sachidananda Kamath, is a President National IAP 2015. I welcome you, sir, on behalf of IAP-TNSE. And I welcome guest of honor, Dr. Riaz. So he's currently IAP Kerala State Branch President. I welcome Dr. Riaz, sir. And I welcome Dr. Bala Shankar, President 2024 IAP-TNSE. And President-elect Dr. Somasundaram, Vice President Dr. Gopal Subramaniam, Honorary Secretary Dr. Narmada, Dr. Rajkumar Treasurer, and Academic Coordinator Dr. Thirumurugan Seren, and Joint Secretaries Dr. Sudhagar, Dr. Jayvarna, Editor Sridevi Narayanan, and AAA Dr. Balaji, and Central as well as State IAP members, and National as well as Tamil Nadu IAP, IAP members. On behalf of IAP-TNSE, welcome one and all. It is a great pleasure to welcome our scientific advisor, Dr. M. Singarvel sir. He is currently editor-in-chief of One Day, One Drug Digest. And on behalf of IAP-TNSE, I thank Dr. Singarvel sir for his effort. And I welcome Dr. Thirumurugan for his role as managing editor of One Day, One Drug Digest. And the executive editor, Dr. Balaji, who has worked hard past 1 month and is make this possible. And I welcome associate editors, Dr. Sujata and Dr. Jaiprakash Selvaraj for making this possible. And I welcome Dr. Bala Subramaniam sir, who is our teachers of teacher. And I welcome all the teachers all over India as well as in Tamil Nadu who was joined here. And on behalf of IAP-TNSE, once again, welcome one and all. This concept of going for one day, one drug, we have as a presidential action plan we have developed during the presidential action plan announcement at Coimbatore. And this we are going to release each day one drug. We are start with the antibiotics and analgesics, and we are having a lot of inputs from all over our medical colleges and teaching institutions as well as private practitioners to how to go about this program. So according to our feedback, and we are having planning to release one page of this drug with start with pharmacokinetics and usage and indications like that, and for adverse reactions and any poisoning, how to go for about antidote like that presentation. We have started this concept. I think it will be a hope. I think it will be useful for each and every one of our practicing pediatricians as well as our postgraduates all over India. And I really thank once again Dr. Sachidananda Kamath. He is well known our Kerala IAP and as well as National IAP godfather. And sir is joined here to make this one day one drug program to launch. And Dr. Riaz also our friendly state and as well as brotherly state also. We are having good relations past a few decades with our Tamil Nadu IAP as well as Kerala IAP. I think we have to maintain this relation. And in the future also we'll jointly we have to do a lot of academic activities, and national level also we our program also should go. And I need both IAP, Tamil Nadu as well as Kerala. You have to, unitarily, you have to do a lot of academic works. Thank you very much for this opportunity.
Thank you, Rajendran sir, for this. For your, as a part of your presidential action plan, you had already proposed it, and it has. I'm very happy that it has come to a stage where it is taking off today. Now I request Professor Dr. Singaravelu sir, the chief editor of this One Day Wonder, to deliver his felicitations.
Thank you, Dr. Narmada and Tirumurugan, respected President, who is having a lot of good things this year. Among the President's action plan, this is visionary project which he planned quite long time, and I am really honored and humbled that he appointed me as a chief editor. I thank all the team members of 2025 of IAP TNSE for giving me this wonderful opportunity. At the outset, I thank for our chief guest and guest of honor for having accepted our invitation in a very short notice to inaugurate this prestigious presidential action plan. Thank you, Kamath sir and Professor Riaz sir, and all the members of our own TNSE, because now I am getting calls that they could not join because Zoom link is full. Of course, YouTube is, people are joining and they are sending messages. I am very honored and humbled that during the launch, our own mentor and teachers of teacher, SBSR is here, and all our past EB members, OB members, and the present leaders, and various faculties from various medical colleges, all academicians are here. That is the greatness and uniqueness of this program, which is going to be launched under the leadership of Dr. Balaji and Thiru are doing extraordinary work.
Sir, audio is not audible.
Am I not audible, sir?
Audible, sir. You can proceed. Yeah, proceed.
Yes, yes.
Audible, sir.
Thank you, sir. And meticulously planning it and executing it today. The dream has come true. I am very happy to be here and the launching of this program with my president. When I entered into Central AAP as a EB member in 2015, I was the first time entering under the presidency of Dr. Kamath. From then, I took interest in national IAP, and continuously, you all gave me a chance at various levels till to the level of vice president. I am thankful to President Kamath sir, who are always with us, who guided us, from whom we learned a lot. During his tenure of 2015 was a wonderful year, which we came across a lot of good things and how to manage the crisis and all that. Sir, you are a leader. You created a lot of leaders, sir. Thank you, sir. Today, you are with us, being my first president during my tenure as a EP member in Central IAP, sir. Second, Riaz, my good friend, more than a decade, close academician, and we shared our platform in various academics, and we are happy that Riaz is with me as a president of Kerala, and he is a very humble, simple person, always a friendly person who is going to be here as a guest of honor. And thank you. And Bala has joined a lot of outsiders other than state members have joined. I'm really honored and humbled on behalf of our team 2025 AAP TNSE that this program is going to be a very good, useful to the practicing pediatrician, and you will be seeing that during the release of it. Thank you. Thank you all for giving me this opportunity. Thank you. Over to Narmada.
Yeah, thank you, Singaravel sir. Everybody knows that you have been working hard for all the projects brought under your editorship. And now we are also very delighted to have our guest of honor and chief guest. Our guest of honor is Dr. Riaz today, and he's a very hardworking, and we've been working close with him in multiple projects for the past several years. And amongst his busy schedule, he has consented to be the guest of honor for this wonderful occasion. Over to you, Riaz sir, for your felicitations.
Thank you, Dr. Narmada. So, the most respected president of IAP Tamil Nadu, Rajendran sir, Secretary Dr. Narmada, the outgoing president Dr. Balashankar, incoming president Dr. Gopal Subramaniam, our dear friends in Tamil Nadu IAP, Jalil Ahmad sir, Tirmurugan sir, and our teacher of teachers, Balasubramaniam sir, and all my friends here. So whenever there is a program which is launched by Tamil Nadu IAP, we all are interested because there is a very beautiful history of academics. We all loved the PG teaching program, which was happening year after year in Tamil Nadu IAP. And when Shingarvelu sir asked me to join this important program, I was so happy. And I think it's a very prestigious program or very innovative program. Shingarvelu sir had been there for all the programs last year in Kerala as in the capacity of vice president. I think he has visited Kerala many times and he had allotted maximum number of workshops, CIAP workshops to us. And it's indeed a great pleasure to work along with you, sir. And this particular program, which is named One Drug, One Day, will be a gift to the new entrants and to the pediatrics as well as the seniors, because there are a lot of changes which is happening. New drugs are coming in, and we need to be updated. So I think this program will be followed by a handbook also, which will be a ready reckoner. So all the best to the program. And once again, I thank for giving me an opportunity in this. Thank you.
Thank you so much, Riya sir.
Thank you, Professor Riya sir, for your compliments.
Thank you
Thank
so
you,
much
sir.
for your very humble and sweet words. Actually, though Tamil Nadu has been pioneering in academics work, the good ideas always come from AAP Kerala, and none other than Sachidanand Kamath sir. It started with the standard treatment guidelines, which was a very massive hit, and the way you all organize the things here in Kerala is an example for us to follow. And as Dr. Singarvel sir said, Kamath sir is president to all of us. In fact, IAP Tamil Nadu became very active when sir contested for his elections. The thing of unity to be in central IAP all started with Sachidanand Kamath sir. And he has been a guiding force not only for Singarvel sir, for every one of us. And we had the liberty to call him at all the times whenever we had issues, and he has been the guiding force. We are so happy to have him amongst us for the national launch of this One Day One Drug program. Kamath sir, over to you.
Thank you. Good evening to you all. President Dr. K. Rajendran sir, Secretary Dr. Narmada, Scientific Advisor Dr. Shingaravelu, media friend, and other Dr. SPS, and my dear office bearers, executive board members of the National Executive Board members from Tamil Nadu, and my dear colleagues from the Tamil Nadu, which I am really, I know each one of them who are here in the platform. And I am really happy that today you have called me for a very wonderful program. That is, no one has done that. My previous speakers also has mentioned, including Riaz, has mentioned that this is an innovation. But it is, to be very frank, uh, Tamil Nadu does it in a different style. I will tell you that why it is. To name it, you say that academics. To name it, it is administration. To name it as a Tamil Nadu government policies, it has to be learned from the Tamil Nadu. It is not that nowadays we quote the Kerala model. We quote everywhere the Tamil Nadu model. Let me come to that. We took 15 to 20 years to bring down the 2 digit to the single digit to make it a single digit of IMR. You took only 3 years to make it from 10 to 9. That shows the commitment of the government, commitment of the pediatrician who are here as well as who are outside this platform. So that is the commitment we have from the pediatricians of Tamil Nadu. And the model which has been given. When I traveled for my election, or after that, after the winning of the as the president, I could see that the first programs, that is the first breast milk banking in the South India was in Tamil Nadu, not even Kerala. So there is nothing like a success story of Kerala. Kerala, it is a different story. I would always say in all the platforms, we should follow the Tamil Nadu model of how to bring down the IMR or MMR or the maternal mortality rate too about that. So this is a model we'll have to follow throughout the country. We have just see that the IMR from the 2011 to the 2023, the drop in the IMR is enormous, and it is a model for every other state to follow. In spite of being, we have urban area, rural area, where you have literate, illiterate, you have the healthcare facility, you name it, you can compare it with any other states, even the North Indian states where we can't be reaching to the poor or the rural area. So this should be taken as this. So regarding that, that is the administration as well as the support from the pediatricians of the Tamil Nadu. Coming back to the other innovations which has been doing for the last so many years, Tamil Nadu, I can tell you that I can vouch on that the model how Tamil Nadu has been in the IAP, the program which has started with Parthasarathi sir about the IJPP, the program which has started with the persons who have been in the SIRS, SBS's program. The program which has started with the drugs, other infectious disease. The all these programs which has been sustained throughout these years. There is nothing like a 1 year or short term. It is a long-term process. That itself shows that you have the model to be followed. Number three, the program which is now, which as you are bringing out the thing, that is 1 day, 1 drug, that is to be launched today as well as to be carried away. And I feel that it is going to be a digest and it is going to be released after the program. We are very much, we know that the common drug, I came to know that today's launch is for the paracetamol, which has been mentioned. We all know that how and why paracetamol is a commonest drug, in the sense one of the few studies which has been happened, 85% of the parents administer paracetamol to their children. And in fact, we all know that particular brand has been followed for a fever. So it has been synonymous with the fever. So this kind of things are happening in this world, with the more than 50% are self-medicated, OTC, and 25% is recommended, that nearly 23% have the side effects. And there are 13% of the pediatric poisoning is attributed to the paracetamol only. So that means the common drug which we are writing every day and night for a prescription, these kind of 1 day, 1 drug digest, as simple for a paracetamol, it is as good, and it will be followed throughout the country. And I am sure that this program is going to be a very good success. And I hope that this is to be used, this digest or this ready reckoner will be used throughout the country, not only by the pediatrician, but in all the persons who are dealing with children, mean it pediatrician or a GP or anybody, this is going to be a ready reckoner. So that I am sure that this program, by the presidential action plan, by the leaders like Dr. Rajendran, Dr. Singaravelu, who has taken forward. I know Dr. Singaravelu for the last 12 years, which I have been a part of the Tamil Nadu when I traveled length and breadth of the Tamil Nadu when I contested, and even after I win, I had an opportunity to visit 2 times in a length and breadth because of the 2 elections which I faced. So that much close I am having with the Tamil Nadu. So that shows my interest. That's the reason that when Dr. Singaravelu called me, this is the program to be launched. I said that I will be there. Please change the date, and he readily agreed that the Monday can be changed. So that's why I am here. So that's why I have told that I will be the happiest person today to be joined here as a chief guest. Lastly, but not the least, about the Singarvelu, who has taken in charge for the scientific programs. And I know Dr. Singarvelu from the before the he has been EB in 2015, because he has been a regular person who have been involved in the IAP activities, whether he holds the post or not. He works for the betterment of the children directly and indirectly to the advocacy and the other part through the IAP. That means that is the person we all need from the ground level who has to reach the highest office in every organization, that too including IAP too. So no hesitation by telling that he should reach the highest post which the organization should have. And I pray, and I pray that this conference, this one day, one drug digest will be a hit, and I am sure that this will be followed by every person, and I hope that this becomes a major breakthrough in the ready reckoner of every pediatrician and the general practitioners throughout the country. I wish this program a very grand success, and I declare this to be opened for the days to come for
You
this conference.
just wait for 2 minutes, sir. We have prepared a separate inaugural ceremony for the same.
Okay.
I still remember you
Why
came
don't
to the clinic.
you just why don't you just share the PowerPoint? No,
Yes, I thought you would give a brief about this.
No, I
to
will talk about it
Dr.
later.
Thiru.
So
Yeah.
let's do it.
So I will just
No,
share.
I'm free. I am free. I'll
No,
be
sir,
here
it's nice
till
actually.
the
So
till the last. I have told Singarvelu also.
yes, sir. Yes, sir.
Sir, I'm just going to, under your presidentship, can I click out on, sir?
Yeah, I will click that.
Yes, virtual click.
Thank you.
Yeah.
Thank you.
So the launch of one. This is going to be this one, beautifully designed by the team of One Day, One Drug. Now, I request Dr. Thirumurugan, the managing editor of this program, to give the background about this. Meanwhile, Dr. Kamath sir, I still remember you coming to our clinic, individual clinic, and how much you had traveled through the breaths to make it up. I'm sure your visionary leadership will be there to guide us in helping Dr. Singaravelu sir to reach the highest of offices, and we will have the support of Kerala. Thank you so much. Thank you for coming for the thing. Now I give the stage to Dr. Thiru to give his briefing.
Thank you, Kamath sir. Really, we are thankful. Sir, the brain began for this, for our President Rajendran, is no other than Dr. Thirumurugan sir. His meticulous planning for so many weeks to bring this model with his team, Balaji and others, is really laudable, sir. Before he talks, we are really grateful, thankful to Thirumurugan and his team, sir. Over to Thirumurugan.
Thank you very much, sir. I'm extremely good evening, everyone. We are extremely delighted to have among ourselves President of IAP 2015, Dr. Kamath sir, who is whom I met actually in 2012 at Coimbatore, and he was very charming and very simple mannered person. And even after all the posts he has held so many years later, he's still the same. So very much happy to have you here for this launch of this One Day One Drug Digest. And we are happy to welcome Dr. Reyes also here, which basically I'm here to kind of say why this program and then what we are trying to achieve. See, when my good friend, our President, Dr. Rajendran sir, wanted a part of his presidential action plan. So we are looking at various activities which would be of helpful to everyone, most importantly, the pediatricians of the country. And one of the things which we noticed was that See, we are all good at reading our pharmacology during our MBBS days, and then we never touch it again in our life. So what happens is therapeutics is something which we basically get the inputs only from our reps, and then they keep giving a lot of information, which is actually misinformation. And it just happened that recently for one of my talks on antihistamines, I was just preparing. And I realized how wrong I was in prescribing some of the antihistamines. I'm telling you, I was prescribing a lot of first generation antihistamines till I realized the side effects, their problems, their contraindications, everything. And that's where this whole idea of trying to learn a bit more about drugs came. And I'm really grateful that Dr. Rajendran sir had proceeded with this plan of this one day, one drug digest under the able leadership of our senior academician of IAP, Dr. Singaravelu sir. We basically, what we try to achieve is, see, we are all busy people, so we don't have a lot of time to read treatises on drugs, number one. And number two is we also don't have the time to go through a lot of drugs in one single go. So we thought, why not take one drug, just highlight the important things. So when you look at it, you're just going to get a glance what are the important things to look at. And also, as sir said, as Kamath sir said, as a ready reckoner. So you have it. This is going to be available in IAPTNS website. It is also going to be eventually be made into. So what we have planned is every block is going to be circulated as an individual PDF. So you can always look up. And also, we are planning to release it to everybody in a printed format as well. So all possible options, and maybe eventually even also use it as an app so that we can download and have it in your mobile also. I'm really grateful to my team with Dr. Balaji, who is basically the workhorse behind this whole project. Okay, we have designed it and gave it to Dr. Balaji. He has got a team of nearly 50 people working on it, along with Dr. Balama Sujata, Dr. Jayaprakash, Dr. Punita, Dr. Jaypriya, and quite a lot of others, actually about 50 odd people. Basically, he's reached out to most pediatric HODs and the professors of the Tamil Nadu and asked them. So we will plan to circulate one drug one day only. And this is how it's going to be. So a little bit, and nothing, there will not be any unnecessary information. All it will have is a bit of information about basic, very important for pharmacokinetics, which will be highlighted. Like here you could see, we all use rectal suppository. So, but we need to know that rectal absorption is erratic in paracetamol, something like that. And then where you could use it, what is the dose you should be using it. And then what are the most important side effects? Some of which we have often forgotten. So something to remember about it. And then we'll talk a little bit about any important precautions in special population and any important prescriptions. And something very important which we often don't come across is what preparations are available. This is not something which we even look at. Like 1 ml of, let us say, 100 milligram of paracetamol per ml is different from the same dose. It's not applicable for a 150 milligram per ml. And in Tamil Nadu right now, that's what happens. In government sector, we get 150 milligram per 100 ml, whereas in the private sector, we prescribe only 100 milligram per ml. So this is something which we have to highlight. So I guess it takes, we plan to circulate every day so that right at the end of the day, just open it, have a quick look through, and then we'll get it. So it will not be more. So sorry, sir. So basically, that's what the concept is. So it's basically you will not need to spend more than 5 minutes. If you got only 1 minute, you still see 1 minute and get enough important information. For example, in this, again in paracetamol, I just highlight one important thing. OmniOffice realized that there are some preparations of paracetamol which contains aspartame, and if there is a kid with phenylketonuria, you can't use it. I don't think I knew about it. I mean, thanks to Dr. Balaji who I did, and there are lots of such things. So it is a concept, and it is going to come every day. And then, of course, with the end of every section, we are going to have a circulation of it, so it will be available regularly. And I just hope that we will hit about by the end of the year about 300 drugs or so, and then see how it goes about. But I'm really thankful that this project has been accepted by our team from IAPTNSC, and even more happy that Dr. Kamath has agreed to launch this program. and we are very sure that this will be another success. Just to highlight what Sir was saying again, we started our postgraduate clinics way back in 2020, and right now we have got about 115 episodes, which is almost every week we have had, except for those breaks when we had a conference or something like that. So that is essentially 5 consecutive years we have done it actually. So I'm sure we'll do the same with you also. With your blessings and the support, definitely we'll be able to do more. Thank you very much for this opportunity, and I hope that people do get benefited from this. Thank you, sir.
Thank you, Dr. Thiru, for your excellent work, and congratulations on the launch of One Day, One Drug. Now, I also request the man behind and working along with Dr. Thirumurugan for this, Dr. Balaji, to give his short felicitations.
Before Narmada, going further, SBS sir comment. Then
Yes, sir. After Dr. Balaji, I have kept all the cases.
Okay.
Good evening, one and all. First of all, I thank our President Dr. Rajendran sir and Thirumurugan sir, our academic coordinator, and our scientific advisor Dr. Singarvel sir for giving me this opportunity to do this wonderful work. And also thank our Narmada madam and our Commerce sir and Riyas sir who accepted and to come here to launch this wonderful program. Actually, basically, this idea is everybody knows that in pediatrics, drugs are very much important because many times, though pediatrics is a commonly used drug, many times you see that the paracetamol poisoning is very quite common because various formulations are available. Many patients paracetamol, which consists 1 ml contains 100 mg for 8 months baby. So this is we are quite commonly seen in everyday practice. So what is the formulation available? How to use it? How to give it? That instruction should be given to parents. That is very much important. There is our duty. And also when using common drug, but many things being busy in our practice, many times even if you see the paracetamol, IV formulations are nowadays available, but that should be used in single use only. That should be used within 1 hour once you open it. But being it is 100 ml available for a 10 kg child, if you are giving ml, many people use it for a day or two, but which is not advisable. Sometimes it is toxic too. So these are things are highlighted. It means that the common drug we are daily using, but what are things are forgotten or what are things not so far taught. This is our idea. We want to highlight the main things on drugs. What are things every pediatrician or every student should know that. In uncommon drugs, what is the main information they should know? So this is the information we are going to give in the One Day, One Drug digest in this program. But as usual, it is not like textbook. We no need to read everything. At the same time, it should be catchy. It can be used as ready reckoner. And you can just, if you have doubt, if you go through it, you will have all the information which is ready to use for a day-to-day practice. That is the information we are going to give. In this juncture, I have to thank all the other my team members who are accepted or volunteered to come forward to prepare the material for this wonderful program. So I hope this will be very much helpful to each and everyone. So thank you one and all for this nice opportunity. Thank you very much.
Thank you,
Dr.
Balaji.
Balaji,
Thank you,
briefing
Balaji.
about the idea about this thing, and we are very sure this will be a very useful digest for every one of the pediatrician across India. And thanks to your team who have worked so hard for the same. Now I request our senior teacher, Dr. Balasubramaniam sir, to give his felicitations.
Thank you, Professor Singaravelu, and for this request from you to say a few words. It's just a fantastic move. It's a great plan. And I can also tell you, anything Kamath puts his hand on, it will become a success story. Kamath is a lucky mascot. So if he starts, I don't know, Singaravelu must have chosen Kamath mainly because he wants to make this a success story. If Kamath starts anything, Kamath will win, we will win. Okay, I'm very happy about it. My humble request to the people, the Balaji and the teammates for who are planning to do that. But I just saw quickly in the paracetamol, there is some description of intramuscular paracetamol. Please remove it. Please remove it. Intramuscular, there is mention that only rectal paracetamol is poorly absorbed. IM paracetamol is also poorly absorbed, painful, not to be given, very poor bioavailability. So when we are, it may go to general practitioners also who will continue to use injection paracetamol intramuscularly. So my request to the team, please circulate it to at least 10 people before you come out. I know you always have pressure of time, like many IAP programs. President Kamath will say, you give a module within 10 days, okay? And everybody will start working hard. So let the team led by Balaji and others at Tirumurugan circulate it to at least 7 or 8 people to ensure that whatever information that is there is perfect, does not lead to any wrong messages, like I saw mention about IM paracetamol. I'm sure Balaji would do a good job of it. All the best to you. All the best to Professor Singaravelu. Thank you very much.
Sir,
Thank you so
thank you,
much.
sir. Thank you, sir.
That is
Sorry,
why,
just for interruption. Madam, thank you very much, sir. I will remove it, sir, and will do the best as per your advice, sir. Thank you very much, sir.
yeah,
Thank you.
it's all. Thank you, sir. You're always elders and you're leading us, right? And usually in PIDA also, we had troubled you so much before we released even a single question. And in spite of that, so much mistakes was there. You're always our teacher to guide us in the proper way. I'm sure Dr. Balaji will ensure that this mistake is corrected. Thank you so much, sir. Now I
Thank you,
request
sir.
Dr.
Thank you, sir.
Somasundram, President-elect, to give his felicitations.
Good evening, guest of honor, Dr. Kamath sir and Dr. Vyas, dignitaries of IAP Tamil Nadu, and the team of the ODODD, Professor Singaravelu sir, Dr. Tirumurugan, Dr. Balaji, and his team. First of all, hats off you, because see, all your presidential action plan is on the execution one by one. And this is one of your presidential action plan that has taken its wings on this day under the leadership of with the opening remarks of Dr. Kamath sir. And this is this drug information, which whatever you learn, it keeps changing. So new things come up, and we will not be able to store all those information in our mind, even though we keep practicing with these drugs. So this will be will definitely be a ready reckoner for all the pediatricians, including the general practitioners, as Dr. SPS are told. This will help as a ready reckoner for all those who is in the needy of use these drugs. And if common drugs are being concentrated on a day-to-day basis, this will have a national-wide presence, and it will be a great success for you, sir. And the reach will be more. Thank you very much, and all the best for this 1 year of this program, sir. Thank you.
Thank you, Dr. Somasundram. I'm sure we will see the anniversary of this in your presidentship, but till then we'll keep releasing the important drugs. I'm very happy to now invite Dr. Balachandra sir, Chairman, Environment Child Health Chapter of ECHC, for his felicitations. Sir has been a good friend and a very hard worker for each of this project. Very happy to have you on our platform.
Thank you, Narmada. Respected President Dr. Rajendran, President-elect Dr. Somasundaram, our Professor Singavarelu sir, Chief Guest today, Kamath sir and Dr. Yas, all my colleagues in the year 2023, Dr. Jalil, Dr. Sudhagar Prasanna, Dr. MSV, and Teacher of Teachers, SBS sir, the current DBs, and all Dr. Tirumurugan, Dr. Balaji, and all seniors of IAP Tamil Nadu. Thank you for inviting me to felicitate a very important meeting, that ODODD. This ODODD remind me of about the old song, Kolavari Kolavari D, the Tamil song. So, a good one. Professor Singaravelu sir has been my vice president in 2023. We had a good rapport with him. Whenever I ask for some action plan, he immediately will sanction that. Thank you very much, sir, for the last one beautiful year we had at the EB. This ODODD is a very good action plan by the Dr. Rajendran, and I would say that we should bring one more for the public as well, a simple one to to avoid the fear of drugs, this medicine, modern medicine drugs of the public, especially the inhalers and all. So for the public should be a different one. So I congratulate IEP Tamil Nadu chapter under Dr. Rajendra and Dr. Narmada for bringing out this digest, and we will have a good knowledge about this for the next 1 year. As Narmada said, we'll be continuing till Dr. Somasundaran take over as the president. Thank you very much. Jai Hind, Jai IEP.
Thank you, Dr. Bala. Your ringtones always had peppy Tamil Nadu number, Tamil Nadu songs. I didn't know that you had also innovated a new innovation for our ODODD. So I hope we make a rhyme out of it. Having said that, I request Dr. Aram Sendal sir, past President IAP TNSC, to deliver his felicitations. Sendal sir.
Thank you so much for the opportunity. The dignitaries on the dais, everyone, vanakkam to all, especially Dr. Sachidananda Kamath, Dr. Riaz, Dr. Bala, and all our stalwarts of IAP Tamil Nadu, and the office bearers especially, who have come out with a really, an innovative program. This is going to reach heights, and my best wishes, and always the innovative brain will definitely win the hearts of all IAPians. Thanks for the opportunity and best wishes.
Thank you so much, Sendal sir. Edo kavitha எழுதிருந்தீங்க. I'm sure நீங்க அதுல circulate பண்ணுவீங்கன்னு நினைக்கிறேன். Thank you. He is always he writes very beautiful lines in Tamil as a poetry, sir, and I'm sure he will circulate it for this one also. And having said that,
yes, give me some of the this things to me also at one stage.
Yeah. Thank you so much, sir. We are almost coming to the end of the program, and we are very happy that so many of our dignitaries have joined the dais. We acknowledge the presence of Dr. Jaleel sir, Dr. M.S. Vishwanathan sir, and our past presidents and EB members, the Joint Secretary, Dr. Somasundaram, who has joined us, and many of our past executive and present executive board members who have joined in this platform and given us encouragement. We almost had around 100 people joining us in the Zoom link itself, and I'm very sure we had many people in the YouTube. I personally thank our chief guest, Dr. Sachidanand Kamath sir, and Dr. Riaz sir, guest of honor Dr. Riaz, and Dr. Gopal Subramaniam sir, who had to leave, the vice president, who had to leave for his function in IAP Kanyakumari. I thank Dr. Professor Singaravelu sir, who has many ideas, and he has started off with this even before competing for the highest position. He has ensured that he has brought in whole of Tamil Nadu together. So that is the biggest achievement we can see. And under his presidentship, I'm sure we'll have many more exciting projects. And of course, Dr. Rajendran Anna, he is having every day, he makes sure that we all work. From morning 6 o'clock, we can see his messages. I am like, wow, how am I going to do this? So I have to plan my day according to his messages. So and he's very active. Thank you, Anna, for keeping us all vibrant and bringing together. Thank you, Dr. Tirumurugan, again, one of the very vibrant person, and who has designed, always on the toes, and made sure everything is on perfect. And Dr. Balaji and his entire team, a very vibrant team. With that, I think with the permission of Dr. Rajendran sir, can we close this program?
Yeah, thank you on behalf of IAP TNSC. I thank our chief guest, Dr. Sachidananda Kamath sir, and Dr. Riaz, and as guest of honor. And I thank all the dignitaries and postgraduates as well as teachers who has joined here. Once again, thank you very much. Thank you.
Thank you all for joining us, and thank you.
Thank
Good
you.
night.
Thank you, Kamath sir.
Thank you, sir. Good night.
For
Thank
sparing
you.
your time.
Thank you.
sir.
No
Thank you, Kamath,
sparing.
sir.
You call me, I will be there. That is what I have told you.
Yes.
And I repeat that.
Thank you, sir.
Kamal
Thank
sir
you.
is not
Always.
only
Thank you, sir.
participating, we want your inputs also for all the programs. If
You call me, I have told you, you call me, I am there. That more than that, how can I do?
Yes, sir. Thank
Shingaravelu
you,
sir,
sir.
I want to tell you one thing,
Thank
one
you,
more
sir.
thing.
Thank you, sir.
Unofficially,
Thank
Sachi
you.
sir was not there for my installation as a ECSC chairman. He is
Ah,
there full day for you. That shows the importance.
that
That's
is
my first
that is
time,
That's
no, that when Bala was there, I was little bit scared when I saw him. So that's why I never kept quiet before releasing that.
That's why I said unofficially. No?
yeah.
Bala, we were all there for your
You are there.
But
But
he
Sachi
told
sir's
that I
presence
was
is
not
special.
there.
No?
yeah.
Thank you. Really.
Thank
I
you,
am
sir.
really sorry. I am really
Thank you,
sorry,
sir.
Bala.
Thank you.
I know,
Thank
sir.
you.
Bala, don't leave
Thank you.
Kamal sir. Ask him repeatedly.
He'll be there. No problem.
He'll be there. Sorry, environment chapter is close to your heart, sir.
Thank you, sir. Thank you.
Thank
Thank you,
you.
sir.
Bye.
Thank
Thank
you.